Hi, I'm Lori Hoffman from Watertown Albury Community, and I'm here to help you learn about spay and neutering your dog. We at Watertown Albury Community encourage people to keep their dogs from producing puppies, since we already have so many dogs that need loving homes. However, because we want the best for our dogs, both behaviorally and medically, a lot of questions come up about spay and neuter, and Holly Lewis, a certified dog trainer, and Kelsey, Ricci, veterinarian, are here to help us learn about that. Holly, can you tell us a little bit about yourself?
Absolutely. I am a certified professional dog trainer. I've had my own business, which is Cold Nose Canine, for 9 years. I've been training for probably about close to 20 years. Really got my start by needing to understand my rescue dogs more and learning more and more about them so that I could help them and others more. And I utilize all positive reward-based training that is has a foundation in science and research. It's all about learning theory, so it's good stuff.
Thank you. Dr. Kelsey, can you tell us a little bit about yourself?
Absolutely. My name is Dr. Kelsey Ricci. I graduated with a veterinary degree from the University of Wisconsin in Madison in 2014. I've been practicing for about 5.5 years as a mixed animal veterinarian. So I spend a lot of time with pets like dogs and cats, but I also do go out to farms and work with cattle, horses, and other species like that. I currently work at C.J. Hazy Veterinary Services in Reeseville, Wisconsin, and I really love it. I really love what I get to do.
Thank you. We'll open with some basic questions, and then we'll take questions from the audience. We'll only be discussing dogs today, since cats are a very different topic. The first question is for Holly. What are the possible, and we're only talking about neutering dogs in the first half, so it's easier to separate out the different subjects. What are the possible risks and benefits of neutering a dog?
So we're talking spay neuter, right?
Using
neuter as a generic.
No, we're talking neutering first.
Just for
males. And then we'll talk about spay later.
Okay. So the benefits from research. So there's very minimal research about the behavioral effects of neuter. It's kind of a newish topic. There's a study that was done in 2003, one done in 2010, and then a more recent one done in 2018. But the sample sizes haven't been huge, so a lot of information that you see is very anecdotal. What research has shown us is that neutering, the main thing that it does is it will lower energy and it will reduce marking, urinary marking. That's the only thing that research bears out.
Okay, does research bear out any risks to neutering your dog?
So far what the research has shown is that animals that are neutered, specifically before 12 months of age, actually have a higher risk of aggression, touch sensitivity, anxiety, and fearful behaviors.
Okay. Right. And Dr. Kelsey, medically, what are the risks and benefits of neutering your male dog?
Yeah, so it's a good question. We wouldn't be here unless it was somewhat unclear of why. And, you know, as Holly attests to, the research, or maybe the lack thereof, being very concise. Same with medically. We have some information. I wish we had more. And what we're finding is that, you know, in the last several years, it's become much more of a controversial topic. We're talking about it more. There's more studies coming out, and not all of the studies agree as I, would like to can be concise to make specific recommendations. But what we are finding is that we are seeing differences among breeds of dogs and sizes of dogs. And so one approach is not recommended for every single dog that's out there. And like a humane society or a rescue situation is very different than you having your own pet in your home. I mean, they're just different things to consider. So as speaking of, risks and benefits, risks from a veterinary perspective, it's a surgical procedure and it requires removal of, certain parts. And, with that comes the risks of the actual procedure and the anesthesia they have to go under. Fortunately, in recent years, we've made huge strides in the safety of our medications, how to observe the dogs while they're under anesthesia to be able to anticipate if something is starting to go wrong before it becomes a problem. And medication-wise too, we're getting much safer medications than we used to have. So yes, that is a risk to definitely consider, but improvements are being made, I would say, every 5 to 10 years. Risks also, Holly mentioned a little bit about decreased energy, levels in the male dogs, and we do see weight gain often with dogs after this. Do we know exactly why that is? Not always. There could be many factors. Fortunately, as dog owners, there's a lot of things that we can do to help prevent that by just increasing exercise, monitoring the calories the dogs are getting, and that helps reduce a lot of these risks that sometimes we see with neutering. Now, there's a lot of other research which they say, it is just a lot of stuff that are small research studies on just a few dogs here and there, and all of a sudden these words of cancer start popping up that we could potentially increasing the risk for these certain cancers in these dogs. And but what we have to look at when we're going and sifting through that research, I encourage all of you to be in conversation with your veterinarian, because this stuff is hard to work through because it's not very clear. And so there's different cancers that potentially you can see an increased risk after neutering. However, these cancers are very breed dependent, and also many of them are very low percentage of ever seeing it. I mean, we're talking 1% or lower. And the studies they're doing on dogs are sometimes very small studies, only a few dogs. And so it's very hard to know the full picture. So I encourage you, if you do start seeing this, in the news or online, that you dig deeper, talk to people about it, because the benefits of neutering there's a lot of them. We actually see an increase in life expectancy with neutering dogs. They actually do have studies that have shown that, and increased by 13.8%. We have seen life expectancy. So if your dog's expected to say, let's say 10 years, hopefully older, but 10 years, you could now expect your dog to be closer to 11 and a half years old. Obviously, the benefits of unwanted pregnancies, that's significant as well with pet overpopulation, and the benefits of neutering. In some behaviors, I did find a study, and again, we have to kind of take it with a grain of salt, but we do see a 90% reduction in roaming behaviors, a 70% reduction in mounting behaviors, and potentially a 60% decrease in aggression with potentially other male dogs or around a female that's in heat. Obviously, it's not going to fix all potential concerns with behaviors by all means. That's why we have Holly here. So that's definitely something to keep in mind. And then there's a few other diseases as well, it can help reduce the risks of those as well, including testicular tumors and other concerns with the prostate as well.
Thank you. If you don't want to neuter your dog, but you still want to prevent unwanted breeding, are there alternatives to neutering, say?
Yeah, good question. So like I said, the major practices of neutering is the full-on procedure where we remove the testicles. But there are two other, there's many other, I'm sure, that are described, but two others that have gone, that we've looked into a little bit more. There's one called the vasectomy, which is, a lot of humans can relate to that particular procedure. It's where we keep all the structures in the dog, but we remove, a very small section of the tubing that allows them to become sterile and not cause pregnancies. And then there's another procedure that's actually an injection of something called zinc gluconate. And it doesn't require surgery, which is nice, and it's just an injection that is done to hopefully sterilize the dog. But there are kind of pros and cons to both of those.
Okay. We are off to spaying your dog, your female dog now. What are the benefits and possible risks of spaying your dog behaviorally?
So behaviorally, the benefits are you don't have to deal with unwanted or surprised puppies, because from the human standpoint, that's a whole lot of...
There's a lot of management otherwise.
Yes,
right?
and raising that litter of puppies responsibly so that they are able to be adopted and be great members of the community and have all the proper socialization and everything. So that's a huge thing. Not every female dog is cut out to be a dog mom. So there's considerations from that standpoint as well. Behaviorally, again, we don't have a lot of data to support the spaying, especially early spaying. Some of the studies that have been done are, they did look at dogs that before the 12-month range, and that's when they did see the increase in potential aggression or stranger danger or increased touch sensitivity and some fear and anxiety behaviors. But again, the data is out. I will say personally, anecdotally, I see very, very minimal change when I'm working with clients and their dogs are then spayed or neutered in the time frame that we're working. It doesn't have the impact that everybody wants it to have.
Gotcha.
So, yeah.
And medically, what are the possible benefits and risks of spaying your dog? I know we talked about this with our own dog.
Yes, we did. Which prompted this conversation, which is great because it isn't clear, and I'm glad you came to me and we could talk about that. So, risks, as with neuters, it's a surgical procedure. There's risks with the anesthesia and the procedure. Again, we've made a lot of advances in improving the technique and the medications used. And so the risks are much less than they were 30 years ago. Again, with females, we do see a risk of weight gain as well. That we do feel that we know a little bit more about as far as estrogen presence sometimes can decrease appetite a little bit. And so when we remove that, more likely the female dogs are to eat kind of indiscriminately. So it's really important that we manage their meals, we manage the nutrition that they're getting, watching the table scraps and the extra treats, just because they are going to be prone to put that weight on, but they aren't doomed to necessarily put that weight on if we're good about watching that. Another risk is urinary incontinence. We do see that. We're trying to learn more and more about that of timing of spaying. Can we decrease that risk or not? We think in the studies that we do have, about 2 to 20% of dogs potentially could develop this. And we see it more in larger breed dogs, say over about 50 pounds. Fortunately, this particular condition, we can minimize the risk by spaying after 3 months of age, and we may be even narrow it down even more in the future as studies progress. And fortunately, that condition can be managed with medication. They're not doomed to have incontinence the rest of their life. There is ways to manage that.
The incontinence usually shows up later in life. Am I?
Potentially, yes.
Yeah.
You can find it as soon as a year after, but yeah, you are seeing usually 8 to 10 years later after the surgery. So it's not immediately on recovery. It's like you said, Holly, thank you, later. And just like with male dogs, there are certain types of cancers. Sometimes we do see an increased percentage, but it's very breed dependent because certain breeds are at higher risk for certain cancers than others. So that's something you have to keep in mind. And again, fortunately, most of these diseases that we're talking about in these studies are very rare cancers, which is a good place to be if you have to be worried about that. However, for the benefits, again, females, we're seeing an increased life expectancy by 26% in female dogs as opposed to an unspayed female dog. So you're looking like a 10-year-old dog going to 12 and a half years, or a 14-year-old dog to go in 17 plus years. And that's significant, despite all of these other risks when it comes to, maybe increases cancer, maybe increases this, but overall these dogs are living longer despite these risks. So that's something I think is really worth paying attention to. Not to negate any risk, we should be considering everything. Obviously unwanted pregnancies, again, and symptoms of heat cycles. If you've ever had a female dog going through a heat, there's certain considerations that need to be done during that. And so obviously if they're spayed, they're not cycling. But the two major things that we had talked about with your dog are two conditions that we see in female dogs that spaying can really, really help with. And one of them is something called a pyometra, which is an infection of the uterus. And there are a lot of actually increasing studies about that, especially over in Europe as opposed to the United States, because Europe doesn't spay and neuter all of their dogs as often as the United States does. And so we have kind of these two different populations that we can look at. And especially in those dogs that are less likely to be spayed, they're finding that this infection is occurring in almost a quarter of dogs, 24 to 25% of dogs reaching about 10 years of age. And so when they get an infection of the uterus, it's not like, just throw them an antibiotic and you're better. It's a very serious condition. Dogs are very, very sick. They sometimes require emergency surgery, and they have to go under surgery when they're not doing very well. And so there can be a lot more complications with that. And so by spaying your dog and removing the uterus, then obviously that's really not a possibility to happen to your dog. The other condition is basically breast cancer or mammary tumors. That's another condition that we're learning more and more about as time goes on. In females and there's a lot of studies out there, so we don't really know the exact numbers yet, but we're finding tumors in these glands in female dogs as they get older in 25 to 66% of dogs. So we're finding them often, and about 35 to 50% of these tumors are malignant, meaning cancerous and can spread. And of those that are cancerous, they're finding 70+% are able to spread to other areas of the body, making it very, very hard to treat and causing your dog to potentially pass away much sooner than they should. And as a veterinarian, it's very, very hard to see this particular type of tumor, because when we find a tumor in our dog, we want to figure out what it is. You know, we don't just want to like leave it there. So a way that we can do that is to do some testing and use a needle to get in an aspirate, is what it's called, to look at the cells to see what's going on in there. Unfortunately, with this type of tumor, if we poke it, we can actually make it get worse. And so we can anger the tumor, and it can actually spread faster. And that is the last thing as a veterinarian I want to do, is make your dog more sick by trying to find an answer. And so that we found that with spaying dogs before their first heat cycle, the chances of this particular cancer are about 0.5%, very, very low. If we spay them before their second heat cycle, that chance goes up to about 8%. And if we spay after their second heat, or 2.5 years of age or later, we're back up to about 24, 25%. But again, that shouldn't be the sole reason you decide to spay your dog, but it's significant enough that it's worth mentioning. And I guess those are the main things. There's a few other smaller possibilities of benefits that we can do, you know, certain ovary cancers and uterine cancers that obviously we can prevent by removing those structures. So yeah, a lot to talk about with spays, but it's good to know.
So you touched a little bit on if you decide to spay your dog, what is the best age?
It's great.
So
Great question. Yeah. Because there's no one answer. So when it comes to, basically it depends on what you are most concerned about with your dog. And that's important to look in the family history. So if you get a dog from a breeder, it's important to ask the breeder, you know, what's the family history? Is there a condition we need to be more worried about than others? Certain breeds, certain families are more likely to get certain diseases. And so if those are very present, then you want to do what's best to reduce those risks when you choose to spay and neuter. So for, like, in the research that we've done, Rottweilers, males and females, are prone to a certain bone cancer called osteosarcoma. Terrible, terrible disease. Very uncommon in the general population, but Rottweilers just drew the short stick on this one. But we found that if we spay and neuter Rottweilers over a year of age, that risk is greatly minimized. Otherwise, I think it's 3 or 4 times a risk of developing this disease if they're spayed or neutered before a year of age. And that decreases 4-fold by waiting until they're over a year of age.
Wow.
There are other concerns as well, obviously the mammary carcinoma before the first heat cycle, but you have to keep the big picture in mind. Yes, that might be the most pressing issue for your dog, and certain breeds are predisposed to that type of cancer, but not every dog is. And so other things to consider, you know, hip dysplasia, knee injuries, a few other cancers as well. Depending on the breed of dog, we may recommend spaying closer to a year of age as opposed to 6 months. And then some giant and large breed dogs, maybe 12 months to 18 months.
So you really need to have this conversation with your vet.
Absolutely, yeah. I can't just tell you one answer. It does not apply to all. Yeah.
And Holly, what are some of the, if you decide to spay your dog, what behaviorally, what considerations are there at different ages? In other words, after you talk to your vet,
Right.
taking into consideration the behavior, what do you think the best age to spay would be and why, behaviorally?
So behaviorally, we have no research based on age. So I don't think it's a fair assessment for myself or any other trainer to make a recommendation. We have our personal feelings. I know if I had an intact dog that I got as a puppy, I know what I would do for me. But again, that would involve a discussion with my vet to talk about all the different implications and things.
Big picture.
Yeah. The thing that I would be most aware of is that dogs have a critical socialization period between the ages of 4 weeks and usually like 4 months, 14 to 16 weeks. So because after they have their spay, they usually have to be quiet, crate rest for 10 days or so. I might try and avoid that area because it's what they learn in that time frame just impacts them and sets them up for the rest of their life. And so if you can wait until they're after 4 months old, I would absolutely recommend that, so you don't have to have those 10 days, you know, on bed rest kind of a thing
Right, where they're
after
not
the
learning.
surgery.
Okay.
Yeah, and where they're not getting those positive exposures. I might also, just as in a much softer way, there's a secondary fear period that can happen anywhere from 8 to 14 months, and that is a very fluid time frame. So don't quote me on that. But that's a fear period where you see dogs that things that used to be okay for them are all of a sudden scary, and so I might try to avoid that time frame as well.
Okay, can you clarify, like, what is a fear period?
Yeah, so they're referred to as fear periods, but it's also could be called a socialization or a critical learning period. So that first one is the most important, the 4-week to 14-week or 16-week. There, the things that they're learning set the foundation and the base for the rest of their life. I mean, you can make or break a dog in that time frame. And that is one of the benefits of getting a dog from a breeder if someone chooses to go that route.
A
Or
responsible breeder who knows what they're doing.
Yes, absolutely, absolutely. Or to, you know, get a puppy from the shelter or rescue or something too, is to be able to impact the dog that early in life. So the secondary fear period is much less known, much less talked about. I work with a lot of clients when they say, well, my dog all of a sudden in this age, they used to be okay walking by this house that has this statue in front of it, and all of a sudden one day they stopped dead in their tracks when we got to this statue. You know, so it used to be okay and now it's not. Or they'll say, it seems like everything just fell out of my dog's head, like everything we've learned. They can't remember. They don't follow anything, which is very normal as part of that growth period and that growth cycle. And it's just a good awareness for people to have.
Well, thank you. Yeah. Right now, I'd like to open up questions to the audience for Kelsey and Holly. Do you have any questions?
Well, I've got one. If nobody else is going to go, you talked about the neutering injection. I forgot the chemical name. Is that a one-time?
Yeah, good question. I was hoping somebody would ask about that, so that's good. Hold on. I did some research too before coming. So there is it's an injection. It's called Zinc Gluconate, and it is supposedly supposed to be a one-time injection. It's not a common practice here in the United States. The times that they've used it are very, I think there's 3 papers maybe on it of 3 or 4 different instances of it being used. And the goal is that it causes the testicles become sterile, and so they no longer produce sperm and testosterone. And so this is used in areas where veterinary medicine is not easily accessible to, and so where surgeries are just not realistic, or there's not the facilities, you can't get the medications there, what have you. And so this is for major depopulation of, unwanted, stray dogs. They did a study in the Galapagos Islands where obviously there are very many endangered species there, and so having dogs just kind of running wild is a significant concern for both their health, the human health, and the environment. And so they've done studies on that. They would do huge, like hundreds and hundreds of dogs, and they found the majority of them, as many as they could find for follow-up, were still sterile. There were a few that did become fertile again after a year, though.
Were those owned dogs or feral?
Good question. So they described them as dogs in this particular study were they were running on the streets, but they were fed by people.
Okay.
And so they had their own dogs that came back for food every time, but they did not reside in the household. So that's a good question.
Like street dogs?
Yes.
Yeah.
Yep.
Yeah.
And so
Jim?
Yeah, I know that socialization of dogs is really important. And so after you go through this process, what's the mechanism for socialization? I know we've got some pretty good dog parks around here. So what would be the process that you'd go through to kind of get them through that and start their new life with their new
family
equipment?
Okay, or lack of equipment. So socialization it's a really big buzzword in anything dog. And what it really is the positive exposure to novel stimuli. So basically we look at a puppy and it's like an alien that has landed on a foreign planet. They don't speak the language, they don't understand the culture, they don't know what a TV is, what grass is, what, A, B, or C, whatever it might be, is. And so we're teaching the puppies, we're teaching these dogs all kinds of things and just helping them understand that, oh, this carpet isn't scary, and just because this chair might move doesn't mean it's going to hurt you. So I would not recommend a dog park for socialization. And there's a number of reasons why. The first one is because of vaccination status. We do not know the vaccination status of other dogs at the dog park. And some diseases are highly, highly transmittable, especially for young dogs, and they can be deadly in a heartbeat. And I'm speaking out of turn there, but I mean, that's pretty common knowledge. The other thing I would get concerned about of socialization at the dog park is not everyone has the same definition of what behavior is acceptable or not acceptable, okay? So if my dog goes after one of Lori's dogs and pins it to the ground, Lori might say, oh, well, that's okay, they're just playing, whereas I might look at it and say, gosh, no, that didn't look like a positive interaction. And because we just have different definitions, it's not supportive of the dog and of their emotional well-being. And what can happen then is if Lori's dog has a bad experience, Lori's dog might go, oh gosh, anytime I see a white fluffy dog and it's 40 pounds, that is really scary and I don't like them. So that's what I get concerned about at a dog park, from the disease factor and from the unknown of the other dogs. So what I would look for is taking my dog to pet-friendly businesses in the area. And Watertown All-Breed can help identify those if you need a resource. Setting up play dates with friends and family that have really appropriate dogs that are well socialized, that interact well with other dogs. Setting up appropriate interactions with children, with people of different races, different male versus female, facial hair, no facial hair, hats, big coats, no coats, all of the variations. Those are the things that I'm going to want to set up for the dog as opposed to taking them to the dog park. Much safer medically and health-wise as well as behaviorally. Yeah, that's a great question.
Yeah, there's always inherent risks in taking your dog to the dog park with people you don't know. Watertown All-Breed community is very supportive of the Watertown area getting an individual use dog park where you can meet with friends that you know, and you know their dogs, and you know your dogs all get along. Yeah. As structured socialization, but you and I both go to the dog park, and so there are inherent risks, but you have to go into that with your eyes open. Mm-hmm. So.
And some dogs love going to the dog park, absolutely love it. Some people love going to the dog park, even though their dogs don't love it.
Yes. Yes.
So, it's like anything. It's appropriate for some and not appropriate for others.
Right. Okay. Pitter Patter Paws has brought a little demo of the things that you might need should you decide that spay and neuter is right for your dog. We just went through that, and we made 4 trips to Pitter Patter Paws before we found the right gear. If you would like to showcase their options for gear, this would be a good time to do that. So.
Can they hear me? Can I talk or just kind of show them stuff or?
Here's
like the soft tone.
You can talk, he said.
Okay.
Yep.
So, most people are familiar with the vet one where it's plastic, it's hard. Most people do not like it. The dogs are bashing into things. They can't get into their crates if they need to get them into their crates. So the next best option is like a comfy cone. It's a lot softer. They can lay down and it squishes. To me, I kind of refer to it almost to like blinders on a horse. I think it's a little bit better where they just I think with the see-through, they see it and then they're fashion things, where this, they're gonna be a little bit more cautious with that. So this one we've had a lot of good luck with over the plastic one. I wanted to just show this one too. I got a little kitten here just because a lot of times this is a lot softer too, but it's for very small, either very small dogs or cats. And then we have the Cloud, which does not work on males. The majority of males will still be able to get to themselves. The majority of females do not. I've only had, I think, one person come back that a female could get to themselves. Otherwise, this has worked very well. I've used this on mine. They almost use it as a pillow. It's really, mine could have cared less that she had it on. It really is nice. The next thing that is wonderful, and Lori actually had told me about it, is a little suit that you can actually put on. And they have the short sleeve or a long sleeve. They also have it where you can either pull it over, or this one has snaps. So you can just step it in, snap it up, but they also have a little potty area. So it's got little snaps where it goes and you can snap it on, but if it needs to go to the bathroom, you just unsnap it, roll it up like a little burrito, snap it on, and they can go to the bathroom. I was told by the lady talking to her, because some people think they can just kind of fold it, that doesn't work with a male. They will pee on that. You definitely need to roll it up like a little burrito. But this obviously will work for a lot of different things, not just spay and neuter, but definitely a lot nicer thing. It looks like little PJs to me that a dog will definitely not be freaked out about as with the cone style. So you have a lot of options. And like even talking on the panel, it all depends on the animal. And you really got to kind of know yours and what they will do well with. And you know, and sometimes it's definitely a learning curve. Some will rip stuff right off or destroy it, but at least there's a lot of options for you to go for and look at. So yeah,
Thank you very much. Yeah. Well, this concludes the show, and I appreciate all of you coming and asking questions. And thank you very much for coming, Holly
you.
and Kelsey. Yeah.
Good job, Laura.